All right, so we're going to do joint repair and biomechanics today. So if we look at the spine, how do we want the spine to align itself from the front? Do we want to have curves in it from the front? We want it to be straight, right?
Right.
Why would we want it to be straight from the front?
The nerves will be...
The nerves will fire better, yeah, but that's telling us that the nerves are firing better. So from the front, when we're holding our body, if the nerves are firing equally, the muscles will fire equally. And then that means we will move correctly. If we're crooked because we have an overstimulation of one side or the other, it'll actually start causing problems in the body. So in overall, we want to be straight from the front. From the side, though, we want to have 3 curves. So the curve in the neck, curve in the mid-back, curve in the low back. Those curves allow you to go through life and not have any problems. So, like for easy reference, we want a 42 in the neck and a 63 in the low back. The mid-back is usually compensation 99% of the time, because the mid-back is going to move proportional to whatever the neck is going to be due for writing reflex, or the low back is going to do for walking and keeping its hips balanced. So when we look at the body, what we're going to do is look at the body on A to P, or front on in the beginning. So what we're going to see is we're going to be looking at the bones. And the little triangles are the spinous pieces that come out. So when we're looking at it, we're looking right here, and these are those little triangles right here, those spinuses right here. Does that make sense so far, guys? When we look at it, the nerves come out here. The spinal cord goes through the middle. That's how the body communicates. Now those nerves go to muscles, organs, and glands. So we all know that, right? So let's erase this again, and I'll draw it one more time, and I'll show you what we're going to start looking at. So we got the bones, and we're going to have one go over to this side. And when it goes over to the side, it actually changes the structure, because the bones themselves are not perfect squares. The reason there's actual angles in the spine is because the bones, proportional to where they are different. So like on the cervical spine or the neck, if we're looking from the side, the bones are actually bigger in the front and smaller in the back. And that's why there's a curve. That's why there's supposed to be a curve. Now it's not that extreme, it's more like this. But you can see how if they're bigger in the front and smaller in the back, it'll cause that arc. That arc's what we want to see. So this is setting us up to understand how the body actually works. So then the nerves come out here, and besides talking to, so we'll put NN here for nerve, besides talking to the organs, the nerves also talk to the muscles. So the muscles, interestingly enough, guess where they attach? The majority of the muscles attach onto these spinuses and transverse processes. So the spinous is that triangle, and the transverse is this side thing. That's what they're actually there for. It's for the attachment of the muscles. So when they attach here, they're going to be functioning based on how the nerves, talking from the brain, tell them to function. So what are the 3 things that can cause us to have a faulty functioning nerve system? For the 3 T's, the 3 thoughts, traumas, and toxins, remember those things? What will happen is, when we look at the brain, I'm going slow here because then we're going to get into how it all correlates. If we looked at a brain like this is just a simplification. One side was bigger and the other side was weaker. What happens here is this. This is a very simplification. It doesn't actually get this big of a drastic change. When you become hemispherized, which means when your body actually adapts to a stress, you adapt to the stronger part of your brain. So what are females usually? What kind of brains? Are they right or left brain? Oh, they're strangulation brain? They're usually a right brain 80% of the time. So that means they become right brain dominant when they become stressed. That would be physical, emotional, or chemical. They would become right brain thinkers majority of the time. What happens is if you keep firing into the right brain will become dominant in the way it fires, which will indicate how the muscles work. So the muscles will actually pull the body out of alignment. So the right brain here is coming down, communicating to the right side, and all of a sudden this muscle gets really big and strong, and it pulls the bone to the side. We'll actually pull it out of alignment. Because here's what happens. The body being out of alignment is not a structural problem that started it. It's a neurological problem that started it. So the body being out of alignment is not because the bone is rotated. The bone is rotated because the nerve is causing the muscle to pull it out of position. Does that make sense so far, guys?
Mm-hmm.
So this muscle here is stronger on the right-hand side. So let's draw it now. So it's stronger. So what it does is it rotates the bone to the right-hand side. So the musculature is stronger here and then weaker on this side. So it rotates it this way. That rotation will cause a structural change in the body. So what that looks like is this. The body's out of alignment and we rotate. And now that's what we believe is normal going through the environment. What's going to happen every day that we walk on that spine? Every day that we sit? Every day that we compress it? What we're going to do is we're going to cause more compressile forces on one side than the other. So what does that mean? So are you guys following me so far?
Mm-hmm.
I know this one's kind of boring compared to my normal ones, but
It's interesting.
what that means is this, is that around the bones, we're going to do the front again, there are ligaments. These ligaments go down on the sides, or on the front and the back. So if we look at it from the side, we're going to look at the same bone from the side here. What we're going to do is we're going to draw it. And that triangle thing here is that triangle thing there. That's the spinous process. And we go like this. Now, when this rotates, it'll actually torque, and it will cause it to get tighter in the front. That's how you get an osteophyte. So what it does is it literally goes like this. It rotates, and how the bones work is they're actually a crystalline structure. So they're crystal. And the easiest way I'm used to explain this is it's called the Piezoelectric Effect. So what that means is whenever you compress a crystal, it'll produce a charge. And it actually produces a negative charge. So how records work is you compress the crystal, and then that crystal voltage, based on how much it compresses, produces a charge, and then you amplify it, and then you get music. That's how a record works. The same thing of the crystalline structure being compressed and expanding determines how the body will grow bone. This is called Wolff's Law. And what that means is, whenever I compress a bone, it will produce a negative charge. So whenever I use it, it will produce a negative charge. Now, if you remember from last week's class, when we were doing the osteoporosis and all that stuff, what's the charge of calcium?
2+.
Ca2+, right? So if we have a negative charge being produced by a crystal and a positively charged calcium ion, what's going to happen? Are they going to hang out together or are they going to run away? They're going to hang out together, right? So what happens is this. The bone is here. It's having more force produced on the front, producing a negative charge. I didn't make that right. Producing a negative charge. And then we have calcium hanging out here. And it goes, well, I like that negative charge. Let's go hang out with it. But here's the interesting thing. On the front of the vertebrae here, it doesn't go hang out in the bone as much as it will hang out on that ligament. And you're like, well, what does that mean? What it means is this. That charge is right down here. And so calcium will start being deposited right here. And that's how you get your osteophytic growth that looks like that. It actually forms on the ligamentous structure. So how did this all happen? It happened because the bone was putting more force right here. So we have more negative charge, or more positive charge, or negative. We have more negative charge here than we are producing here, because the bone's always being remade. So the degradation is happening because we're putting more force right here. What's the other thing that's going to happen? If we're putting more force onto the disc that hangs out here, it'll start to push out. It will bulge. Now the reason why that happens is because you change the fulcrum angle. Now, you guys remember teeter-totters? That's what we're going to talk about now. We talk about a simple teeter-totter. So, if we have a teeter-totter like this, and we're equal side to side, when we move, we're okay, right? Now, what would happen if we moved this fulcrum angle, or the center of the teeter-totter, and we put it over here, and it was longer over here? Which one's able to do more work? This one, right? Because it can move more stuff easily. I know we're going to physics and stuff. Most people don't like that, but what I'm showing you here is that. Now, how does that relate? Because this is how a disc is made. We're just going to draw a disc. So this is going to be our disc. In the middle of the disc is a gelatinous material called the nucleus pulposus. And guess what it is? It's the fulcrum to which the bones move around. So, if the bones are aligned correctly, they'll move back and forth, okay, when you move forward and backwards. But what happens? The body gets out of alignment. And how it gets out of alignment is the brain becomes stimulated through thought, trauma, or toxin. The muscle gets stronger, and it pulls it to one side. And when it pulls it to that one side, you change the way this disc moves, because it won't be able to move correctly. Instead of it moving correctly like this, where it goes back and forth, because this disc here is called an avascular material. What does that mean in simple terms? There's no blood going into it. The only way nutrients get in and out are through compression and expansion. So motion. Motion gets material in and out. When it moves correctly, you're okay. But if you subluxate it, it becomes stronger on one side and weaker on the other. The disc itself will not pump correctly, and then guess what happens? It gets deflated. So what's a deflated disc called?
Bulging.
A bulging disc, exactly. Because instead of it being full of liquid and nice and strong like that, it becomes flatter, and it pushes on the ligaments out here, and now that nucleus is trying to compress it, take care of it. But instead of that nucleus, that sphere in the middle, being normal like it's supposed to be, it becomes oval. And when it becomes oval, it doesn't rock properly. And because it doesn't rock properly, you're going to put more pressure on one of the areas. It really gets stuck forward or stuck backwards. It usually gets stuck forward because of the stress we're under in sympathetic tone, and that's a whole nother talk I can go into. You guys have any questions so far? So, what this means simplistically is this. If we're looking at the bones, and they're aligned correctly, we have a nice disc that looks like that. And the body can move back and forth like this, and I'll show you what it should look like on the side. Mind my drawing, I really suck at this. Now it can rock back and forth, okay, because this is okay. Now what happens when we change it? Well, we change it, so that's good. This one's going to be bad. So we're looking at the bad one from the side. What happens is, when it gets dehydrated, it won't rock correctly, and it bulges more one way or the other, and the disc gets flatter. And when it moves, it will apply more force. The other thing that happens is it doesn't stay right in the middle. It'll bulge out more on one side than the other, so it'll rotate more one way than the other. And that will cause negative charge. And that will cause calcium to come in, and then you get bone spurs. So that's how it all happens. It all happens because you have an imbalanced brain causing muscle weakness and muscle strength. The body rotates itself. After rotation, the discs get dehydrated because they don't move. They can't put nutrients in. Then they shrink down. They bulge one way or the other. And then that will give you the disc bulge or the disc herniation. And then that will cause the structure to change because more force will be going on the front. And then it uses a thing called Wolff's Law, which means wherever you apply force and there's a high amount of compression of that crystal, bone will be deposited. So you go, okay, what does that mean? Well, what was the initial thing that caused all that problem? Subluxation.
Is that also the cause of spinal stenosis?
Yet subluxation is spinal stenosis.
Okay.
Spinal stenosis just means narrowing of the canal.
Okay.
Now here's the interesting thing. When you rotate a vertebrae, guess what it does to the vertebral canal? It narrows it. So all you're doing is defining, and I tell this to my friends and my patients, spinal stenosis is in Latin what I call in English subluxation. So Latin for subluxation is stenosis. It's the exact same thing. So if somebody goes, oh my God, you can't see me have spinal stenosis, you go, oh my God, that's exactly what I take care of.
Interesting.
That's exactly what I take care of. Because spinal stenosis just means narrowing of the canal. Now, the only way you can get narrowing of a canal is because the musculature is not firing correctly and the vertebrae rotated. So, do we want to do something invasive, like cut the vertebrae apart? That's called a laminectomy. That's where they cut pieces off. Or fuse it, or do things like that. Or do we want to get the body to communicate correctly so we can inflate the disc back again? The reason why the osteos and the neuro guys don't usually see this is because they don't give it time. They say you're a structure. The only way you can deal with a structure is structurally doing something to you. So we're going to put something in or take something out. And I go, okay, that's very mechanical. What about your body always remaking itself? And that's what's forgotten in allopathic or symptom-based world or medical doctor world. Why don't we see what the body can do? Why don't we see if it communicates, if it'll rotate that vertebrae back, if we can stimulate the bone, stimulate the brain correctly. So we see all this. That's how we got decay. So we have a segment, and it's out of position because it's rotated to one side. That's actually the other way. This is actually what happens when the bones rotate. This is more of an extreme case, but because you remember how I said they're bigger on the front and than on the back, or bigger on the back than the front? When they rotate, they actually increase the size of that rotation. So whatever side they rotate to, that's where you're going to see the majority of the spinal subluxation problem, as in what you can structurally see as the problem. So what does this mean? It's rotated to the right. This muscle is really strong, whereas this one isn't as strong. So if this is the right side and this is the left side, which side of the brain is stronger?
Right.
The right side, right? So the right side is really strong in the brain, and the left side isn't as strong. So what would we have to do to make this side of the brain better? We want to stimulate it, right? Well, guess what chiropractors do? When they adjust you, the body says, adjust me here. Now here's the cool thing. I don't actually push the bone back into position. The body does it. What I do is I apply a light force, and the joint receptors, the proprioceptors, they go, hey, you're doing something good here. Let's put in some information. And information goes up, stimulates the brain comes back down and goes, hey muscle, fire. And the muscle gets stronger. And the muscle pulls it back into position. Because if it was me pushing it into position, what's holding it there?
Nothing.
What's keeping it from staying there? What's making it there? Because we're always moving, shifting, doing stuff. It's changing the brain balance so that it'll fire correctly. And when it fires correctly, it will start holding. Now here's the cool thing. When you have these joints and they're out of alignment, most people in school, if you go to enough of it, you've been indoctrinated into thinking, oh, you have DDD, degenerative disc disease. You have osteoporosis. You have, what's another one I hear a lot of? Arthritis. Oh my gosh, you have the dreaded arthritis. Whatever shall we do? Well, you're just telling me that you have a subluxation that's been there for 15, 20, 30 years. That's all arthritis is a prolonged subluxation pattern causing disc decay. So when people say, I have a disc herniation, I don't know what to do, I go, you have a subluxation for at least 10 years. And what's going to happen? Say you go a little extreme and you go, you know what? I can't get better. I'm in so much pain. I can't get better. You see the change in the structures here? Because this bone's rotated to the side and this one's straight. If I'm going to fuse that body, how do they fuse it? Do they come in there and break it around and move it around? No, they take it where it's at and then they apply metal here. Or they put chips of bone in there. The metal's called Harrington rods. The chips of bone, that's just a fusion style. Or they cut out things. And they're doing all this because they're not bad people, they just don't understand what they're doing. Here's the problem. When they do this, will this joint ever move properly again?
No.
So what's the byproduct of having this fusion done? That part of your brain will decay. It will actually rot. And what they've shown is your limbic system, there's two sides of it. The limbic is your ability to feel happiness. It is directly tied to your spinal movement. Your ability to feel happiness is directly tied to your spinal movement. I'll say that one more time. Your ability to feel happiness is directly tied to your spinal movement. So what does that mean? If I fuse that, that means a piece of your brain rots and dies. It literally doesn't work anymore because it's not stimulated. Nerves always have to be stimulated to fire. This is why if we know our combination in preschool, or not preschool, say junior high, do we remember it now? No, because we don't use that information. We don't constantly use it, so that neural pathway dies. The brain is always pruning itself. So what happens here is we fuse this, and now these nerves coming here are only getting stimulus from the organs, which is not a lot of stimulus, or glands. Which means when it goes up to the brain, that part of the brain dies, it necroses. It literally stops functioning. And then your ability to feel happiness and vitality is limited. The limbic system is the emotional system of the body and how you feel, how you are. What they've shown is the meso, or I'm not going to say this wrong, the big limbic system, or the ability to feel happiness, is directly tied to the spinal cord. The small, which is in your brain, is the receptor part. So we used to think it was backwards. So that means if we do fusion there, or if we do basically chips or anything like that and stop it from moving, pieces of the brain start to die and deteriorate, and you'll never be able to feel 100% again. The other thing that happens is this. If this joint doesn't move correctly, do you think that disc is going to keep staying okay? If we fuse it, it won't move very much. But here's the thing. If we fuse it like this, and this nerve has compression on it, because we fused it compressed, is it going to keep growing healthier or sicker?
Sicker.
Exactly. And so what we see is your pain may go away with a fusion because they took enough of the pressure off the nerve system where the pain sensors have decreased, but now the organ function is decreased. And we see usually within 10 years, organ damage starts to happen. So there's a correlation between wherever the fusion is and organ disease. So if you start fusing the low back, that's when you start seeing prostatic issues and things like that. Does that make sense? Because we fused it in the wrong position. And we fused it in the wrong position because the brain is weaker. And now that part of the brain will never be able to. Now, when you come in, I just basically have to teach this thing as one segment. So I have to take care of it as one big place and do the best we can. But as soon as you start having these things done, it makes it harder and harder for me to balance your brain, because now it'll never stimulate that right part properly again. Does that make sense, guys? So I went off topic there for a little bit, but so we have the body, and the segment is rotated to one side, and the other segment is straight. And we want to stimulate this side of the brain to make this muscle stronger, because this one's really strong. And as we stimulate it, it keeps getting better and better and better. Now, how do we stimulate it? There are multiple ways to stimulate it. We have to, originally, I want to see if I can figure out what's the cause of this. Because if you have a structural cause, it's really easy to get rid of. Because you have an impact to the body, I adjust you, and when I adjust you, there's another impact per se, and that stimulates the brain easily. What if the cause is an emotion? What if the cause is that you're so, an easy way for people to understand this is, what if your cause is anger? What is a liquid that people take in that allows them to express anger? Alcohol. Because you bring in alcohol and it stimulates your liver where you hold emotion of anger, and then you can express it. Now that doesn't mean it's a good thing, but you're expressing it, right? So where are we holding this emotion? What I'm talking about here is called a viscerosomatic reaction. That means an organ to muscle reaction, or an organ to a soma, or the soma. So if you have a subluxation due to an overreactivity of, say, a liver, heart, kidney, different things like that, that can actually cause a subluxation, because it's overstimulating as part of the body, and the brain becomes overstimulated on one side and rotates it out of position. So we have to find out, is it chemically induced, is it emotionally induced, or is it physically induced? When we find that out, then we can stimulate it correctly, get these muscles stronger, rotate it back, and then when it rotates back, it'll move and pump that disc, and the disc can reinflate. And that's why I've shown you guys people who came in here and had bone-on-bone arthritis, and literally, within 2.5 years, have 70% of a disc again, because their body can re-heal it. It's just how long has it been sick for? If we get to the point where there's no more of that nucleus in there, and we can't move it because it's literally fusing together, it's like a Ferrari that hit the wall at 150 miles an hour. We're not going to fix it. It's a write-off, right? But the thing is we got to see this before, because the problem we have in our country is that we don't understand that this is something that can go away. We're told, oh, you have the arthritis. And then we'll do crazy things like take hyaluronic acid. And you'll go, well, what's that? It's called aspirin. So we literally take aspirin. Now, why are we taking aspirin? Because it inhibits the pain from the joint. Do you think taking an acid is going to be good for a joint? No, it eats away at the joint. So you feel really good as the joint keeps getting sicker. So we're taking aspirin to make it feel better, and we're literally decaying the joint.
So those who take aspirin for circulation?
For circulation, so that concept is because it decreases platelets.
That makes things.
Yeah, the fibrin doesn't work as well. The problem with that is if you take aspirin at a high level and repeatedly, it'll increase your ability to not clot, and that's why they want that to happen. And so here's what happens. If you take a lot of aspirin, then you get strokes, because you won't clot. So you're making it so the circulation is better, the fibrin isn't made, but because the fibrin isn't made, you won't clot, and then you'll have a stroke. But we got to get this right? So you're not dying of a heart attack, you're dying of a stroke, so it doesn't really count. At least that's how the medical doctors can look at it, because it's two different things, even though it's still related. Does that make sense? So taking a baby aspirin, what it does is it will interfere with collagen fibrin production. It'll actually cause scar tissue production, or not scar tissue, it'll cause the brain, the hypothalamus, not the hypothalamus, the medulla and the liver, their heat regulating system to not work correctly, and you start seeing fluctuations. And that's why you can give people aspirin and their fever will drop, but that's also how you get Reye's disease. And Reye's disease is taking something like aspirin, and then the body can't regulate itself, and then you get a disease process from it. So, I know I went off on a little side note there. So our goal is this. Our goal is to take a brain that's out of alignment, that has a structure that's out of alignment, and stimulate it so it pulls itself back into alignment, and then when it pulls itself back into alignment, the disc heals. That's the goal. So the answer is yes, you can get rid of stenosis. Yes, you can get rid of some, if not all, of the arthritis. It just depends on how bad down the rabbit hole you've gone. If you're in the earlier stages, it's easy. If you're in the longer stages, it means you've literally decayed it. If it's fused, because the body will fuse itself to stop you from hurting the nerves. Because the body will literally fuse itself to stop you from destroying its organs. Because if the organs go, you're done. It can live with back pain. Here's the thing most people don't understand, is the body's all doing this to protect you. Now I'm going to throw a little crunch in this that will literally get your heads going a little bit. The body, so to back on that, we want to balance the brain and then everything's okay. This is how intelligent the body is, the innate intelligence of the body. If you have anterior head carriage and it goes real far forward, it's pulling on the spinal cord, pulling a lot on the spinal cord. So we have the brain here, and it's supposed to go like this. That's normal, and then here's the sacrum. If you have anterior head carriage, it's like this, then it goes like this, and like that. And what that does is it stretches the spinal cord, and we can show this on cadaver studies that'll actually pull on the spinal cord. This is how smart the body is. It goes, okay, where would we cause the maximum amount of torsion so that we couldn't hurt ourselves? Do we want it up here at the brain or down here at the butt? Down at the butt. That's why the majority of people, they get low back pain because they're actually shutting off this area. The body's going to cause more torsion down here at the butt because there's a connective tissue layering that actually goes around this whole system. Mm-hmm. And it's called the arachnoid P and dura mater. So it's the connective tissue that goes around it. That layering, as it gets pulled on, will actually cause pressure on the spinal cord. As we move the head farther and farther and farther, the body will actually keep pulling on it. And so what will it do to stop you from hurting yourself? It will cause a disc herniation because it will shrink the distance that it has so that it can have more fluidity in it. So what do we see? I come in here, we adjust it, we take the torsion off of here so the body will correctly communicate, and the disc will reinflate itself. The body's doing it to protect the brain. Everything in the body is done to protect your ability to perceive information. The only job of the body is every single system is to make the nerve system work. That's the only job. Every single one is made to make the system work correctly. So the body will literally cause disc herniations and reinflate them based on how stressed you are for the spinal cord. Because if you interfere with that system, the whole thing will start to fall apart. Does that make sense? Mm-hmm. It's pretty crazy, right? And that's that intelligence, that innate intelligence. Every single thing your body does is smart. Does it mean it feels good? No. Is it doing the best it can with what you've given it? Yes. And that's what we need to understand as a society, is that we are the ones healing ourselves and we are the ones that put ourselves in this position. Because based on the chemical, emotional, and physical stress, it indicates how far along that process of health and healing and what we've done to ourselves. So are the majority of disc herniations and low back pain that I see because of an imbalanced brain? Yes. Now, and I'll show you how powerful the body is and literally why disc herniations are an adaptive thing and a chronic problem. It is never acute. Never, ever, ever acute. If you have a disc herniation, it means you've had a chronic subluxation for a minimum of 10 years. A minimum. So what does that mean? We take an 18-year-old child, or boy or man, whatever we didn't call him, and our body's in perfectly alignment. And we're going to talk a little fluid dynamics here. We have the disc. The disc is made out of a fluid. It's roughly the texture of toothpaste. That's what the nucleus pulposus is. The inside and outside of it has connective tissue, and it's, I'll get into the disc, I'll show you this. So the disc is made like this. We have the nucleus pulposus here, and it has fibers that run at 45-degree angles to each other, so that when you rotate, it will stop it from getting hurt. Now, you take this guy, and he's a motorbiker, or a skier. He jumps off a big cliff, comes down, and lands. What do you think's gonna break, the disc or the bone?
Yes.
It's actually the bone. How do hydraulics work? We compress a fluid and it will only compress so far, and it won't have a problem. So we have a fluid and a crystal.
Crystal goes.
The crystal will break because it's more fragile than the bone, or than the disc. So if you have a fluid crystal, if you have a completely hydrated disc, you will fall and you will fracture these, and the discs will be fine. So the only way you can get a disc to herniate is you rotate it because of a subluxation, because the muscle's stronger here compared to here. Now the disc goes from that, and it shrinks, and it starts to bulge, and it's dehydrated, and it's stuck out of position, and then it starts to cause more problems. The lack of motion causes the dehydration. The motion is what keeps it hydrated and keeps it okay. What, you have a question?
Okay, the airborne people,
The what?
airborne,
Okay.
they have a lot of herniated discs.
100%.
After a couple of years jumping, and then when they take X-ray, you can see the disc there.
So here's my question. How long have they been subluxated, jumping, and compressing it?
Depend the unit.
Because if you did a study and you took people that were under chiropractic care and non-chiropractic care, I guarantee you're going to have completely different outcomes.
The armed forces only have none.
I know. So the dehydration, because of the lack of motion and the continued stress upon it, is what causes the herniation. And that's what the airborne, they're coming down, they're hitting at big G's.
Yeah.
That's what's causing the problem. If they have properly aligned low backs, and their heads aren't leaning forward because they're all stressed out, and they're not under huge emotionally and physical stress like the Army does to them and causes subluxations, then yeah, we probably wouldn't see that. But we're looking at it. You're doing this big camp just to get into the body, so you're subluxating yourself because you're not sleeping for long periods of times. You're not eating very well sometimes. You're not hydrated. You're emotionally run through the ringer to see if you can go through it. All of those things are the things that cause that rotation. And then you start jumping out of planes and hitting the ground. And that's what causes this. Because you can take people like motocross riders, and I've seen this a lot, and this is what will happen. This disc is so powerful that it will go up into the bone. It will push into the bone, and it'll produce what's called a Schmorl's node, or it'll break the end plate. The disc is stronger than the bone when it's fully hydrated, but when it's not hydrated, it won't. So that's how hydraulics work. You can compress a fluid so much and then it won't go anymore, but a crystal will break. And so what you'll see with these people is they'll come in and I'll tell them they've broke their back, and they have, but it's not that bad. You'll see something like this. And what's happened is the disc is so strong that it literally pushed up into the bone and broke it. You see that repeated times. To get that disc herniation, chronic subluxation. That's all it is. Literally all it is. Now, there's different forms of subluxation besides the rotation stuff I'm talking about, because you can have another one, which is a global subluxation. So globally, your body's out of alignment. Now I'm gonna go off onto a little tangent and I'll come back to this. Scoliosis. When we were in school, they taught us one thing. Idiopathic scoliosis, or unknown scoliosis, as the allopathic people say, has to always be rotated to the right. If it is, they're fine with it. If it goes to the left, they freak out and they tell me it's pathology or disease. So if it goes to this side. So why is that? What kind of brains do women usually have? Right-brained. So what musculature is stronger? Right side. So what pulls it to this side? The right side. Every scoliosis that I've seen that is idiopathic, now there are some that are congenital where the bones are misformed and that's harder to deal with, but that's because the mom was subluxated and the actual body didn't form it correctly. So you have to go back into what prodromally were we dealing with? Did the mom actually have the proper communication, the right ability to communicate into that fetus? So if you're straightened like this and you don't have this low back curve, the low back is supposed to have weight on the back, and you're straight like this and you keep walking around, that can also cause disc herniations. Because the disc is not supposed to take most of the weight. It's supposed to distribute it when you move forward and backwards. So the disc herniation is not a byproduct of repeated stress. It's a byproduct of repeated stress causing subluxation that puts you in a compromised state. And the words you will hear is disc herniation, disc bulge, disc sequestration, different things like that, or spinal stenosis. They're all treatable. And if you talk to a good disc doctor, they'll tell you that 95% of the time, if you do nothing, they'll reabsorb themselves. Now, what if you balance the brain and you allow it to move correctly and fluid can pull in, then we can actually see it reinflate itself. Depending on how bad it is, I've seen it reinflate from almost nothing to 70%. That took 2.5 years. Most people don't know if they want to give themselves that much time to get something done because we're in a quick fix society. They'd rather have that quick surgery and feel good for 6 months and then have the problem come back worse. And then I'm screwed because I can't really do much with it. That make sense, guys?
Mm-hmm.
And if you want to look at it, literally it's this simple. Most people that have low back pain, it's because their head goes forward like that. It's really that simple. And it's pulling on it. 95% of the time, that's why low back pain's happening. It's because your head is forward, pulling on the connective tissue in your low back, and that's what's causing the pain. And the chiropractor or the osteopath, the massage therapist, whatever, can go in and look at your low back, and it doesn't get better. But you look at the top, balance the brain, the body balances itself and it heals. So the answer is this. Can stenosis go away? Yes, very easily. Can disc herniations go away? Yes, take some time. Can osteophytes reabsorb? Bone spurs, bird beak deformities? The answer is yes. It just takes time because the body is continually remaking itself. That's why if you break your bone, is it broken forever or does it heal in 2 months? It heals in 2 months, right?
4 to 6 weeks.
Yeah, exactly. So if it heals, that means the bone has to be remaking itself. And the bone does remake itself. The body remakes itself. What we have to do is we have to change the structural alignment due to balancing the brain. You balance the brain, structural alignment is right, it moves properly, and then the osteophytes that grow in the front will reabsorb back. They rarely, if ever, form in the back. The only way they'll do that is if you have a severe rotation with a structural lateral flexion, and then it will grow backwards based on where the most force is produced. And that's called Wolff's Law. So the easy, simple thing that I want to make you guys understand is we want that balanced brain. We have that balanced brain, we have the balanced neurology, and then we have a balanced body. Because our spine and our brain shows us a direct reflection structurally of how healthy we are. The more crooked we are, the sicker we are. It's literally that simple. It's so simple that some insurance companies who do life insurance will take a picture of you standing from the side. And each inch your head goes forward, they add 10 years to your life expectancy going off. So they literally go, your head is 3 inches forward, that's 30 years plus added on. That means you're 60 now, that means we're going to insure you as a 90-year-old. Because they know how much earlier you're going to die based on how much pressure you have on your brainstem. So the answer is, yes, we can get better, yes, we can realign ourselves, but it takes communication between our brain and our body and allowing it to work right so that the body can rotate itself back into position, reabsorb the discs, the bone spurs back in, and then have that properly functioning and properly aligned body so that the discs are okay. Now, if you break it down long enough, it's so sick we can't get it back to normal. There's certain places where it'll go too far and we can't help you. And that's why my recommendation is if you have a child who was born and there was any interventions, C-sections, forceps, normal birth, bring them in to get checked by a chiropractor. Because we're not doing it because of pain. We're not doing it because of disease. We're doing it because of prevention. Because if we can make sure that it grows up with a balanced brain, then it will adapt correctly. And if it adapts correctly, then I don't have to see that subluxation leading to disc herniation when the guy's 25 or 30. I don't have to see these issues. I don't have to see the body not working correctly. And that's why in our office here in Denver, Colorado, if the mother or father is under care, the child is taken care of at no cost. Because it doesn't cost anything for me. I'm just giving money to society to be able to help each other. Because if we have a lot of people that are healthy, that means us as a group of people don't have to pay as much taxes towards sickness. And that's what I'm looking at, is us being able to help each other. I know it's a socialist view, but I like helping other people. So the big takeaway is balanced brain, body's better. The other thing that we can go in, I'll just say one more thing before we're done, is that if you have a scoliosis and it's due to an idiopathic type thing, where that means we don't know what it is, they're actually saying we don't know what it is, we think it's in the brain. They're right, it is in the brain. Scoliosis, I've seen up to 50-degree scoliotic curves like this, and it's because the musculature on one side is stronger, it would be on the right, and on the other side is weaker. And what it actually comes down to is the neural pathway is not working correctly, and it was never activated correctly. And so we have a way of activating it, teaching it how to fire correctly, and causing the brain to fire correctly, it will actually pull itself straight. That 50-degree scoliosis took 1 year.
Wow. How about the hunchback? It's a different.
The hunchback,
Yeah.
like this,
Uh-huh.
well, what do you think it's from?
It's still gonna be in brain imbalance.
It's
still
gonna be,
emotional.
if you got a person who's hunchback, it means they're in such a sympathetic tone
Yeah.
that their neck muscles are pulling them forward like this, and the structure will start to deform.
Yeah.
And
That's
this
why-
depends on how long it takes to deform. And you'll hear something called a Dowager's hump. It's a fat pad that's formed on the back here.
Yeah.
That's formed because the spinous processes are sticking up when they should be sticking down, and it's stimulating that area, and that's stopping them from healing. So it depends on how far along in the decay process they are. If they're real far along, we can do what we can do. But if we can catch them early enough, we can actually help them reform their body and get back. But it's not an easy process, because to get that deformation takes a long time.
Yeah.
That make sense, guys?
Mm-hmm.
So we can heal ourselves, we can get rid of scoliosis, we can get rid of stenosis, we can take care of these things. We just have to take care of them before they get so far down the line that it's a Ferrari hitting a wall at 100 miles an hour, 200 miles an hour. If you just hit it at 10, I can help you out. 20, I can help you. 30, 40, even 50 or 60. But it gets harder and harder and harder as the problems go along. So all I ask is, when you guys have a friend or family member that says, oh my God, I have stenosis, oh my God, I have this, say, maybe you should get checked. Not go see him and get adjusted by him, get checked. And the goal for getting checked is that I let anybody come into my office and get checked at no cost. Because I don't know if they're a candidate for care. But if they get checked, I can tell them if they're right for us, if they're right because of the brain problem, and we can help them and help them take care of themselves. Do you guys have any questions?
Is it possible for their musculature to be too strong for you to be able to readjust it?
Well, we're not adjusting the musculature, we're adjusting the brain. So what can happen is you can have somebody in, and I see this a lot, I take care of a lot of people, that none of their body will move. Everything's locked up. They're completely in spasm. What that means every single time is they have such cord pressure on that the body is locked down everything so it won't get any worse. And what we do is I have a specific technique that I've invented, and when we do it, it will unwind the cord pressure, and then you can adjust everything. So the answer is if we look on a mechanical vision, yes, they would be too hard to adjust. But if we look at it neurologically, we say, why is the body doing that? Why would it lock up everything and stop you from moving? To protect the spinal cord. So why don't we get pressure off the spinal cord and then the body will let it do what it needs to do? And that's what it comes down to, is if the neurology is working properly, the musculature will work correctly, the organs will work correctly. Because the truth is the muscles don't move anything by themselves. The brain has to tell them what to do. The bones don't do anything by themselves. The muscles move them. The only thing that runs everything is the neurology. And the problem is we've got stuck in a mechanical view where we think it's the outside effect and not the cause. So our thing is to look at the cause and the cause of that neurology, have it communicate correctly, and then it goes away.
So the diabetics and everything is caused by the spine?
It depends on what kind of diabetes. Type 2, I've had multiple people, diabetes is another thing we can go into, and it's usually related to hypersympathetic tone. So people who are stuck in huge stress environments. And what will happen is the definition of type 2 diabetes is insulin resistant diabetes, right? And type 1 is an autoimmune problem where it's killed the islet cell ganglion. So what I've seen, and I've seen a huge incidence of this, is that type 2 diabetes is due to an overproduction of sympathetic tone or stress. And when you have a high production of stress, you produce a high amount of what's called glucocorticoids. And what those glucocorticoids do is they prevent insulin from being reabsorbed. So what is the definition of type 2 diabetes? Insulin resistance. What does a glucocorticoid do? Stops you from absorbing. If you produce a lot of glucocorticoids because you're in a stressful environment and produce a lot of sugar, which stress does cause, repeatedly, you produce a lot of sugar out and a lot of glucocorticoids, you will not reabsorb it until the longer acting insulin is produced, which is minutes to hours later. And if you continually stress yourself every 30 minutes to an hour, then you'll continue to cause that problem. And that's why I've seen type 2 diabetics where we adjust them and bring them out of stress and put them into relaxation, it'll go away. And the A1C counts will change and all that stuff, which is just a small indication of a change. A bigger indication would be direct blood sugar levels, but that's a lot of basically repeated doses. The A1C is just an indication of generally what they think the blood sugar levels could be. So yes, type 2 diabetes can go away by proper neurological function changing. So it's not about the spine, it's about taking the body out of stress and putting it into relaxation. The spine is just an indication of how stressed you are. The more screwed up your spine is, the more neurologically stressed you are. Not emotionally and not cognitively. Because I have a stress machine in here that we literally can put people on it and they'll say they're perfectly fine and their heart rate is going off the roof. And they're in such a sympathetic tone or such a stress response that their hands have been so stressed for so long that their body literally doesn't even sweat out of their hands anymore. That's a stress response. And their heart rate just sits and won't variate. And their muscle tone is tight. And this tells me underlying how much of the stress response is causing the problem. So it's not the spine causing the problem, it's the stress causing the spine to be sick. And that's an indication of why you have those things. So the diabetes, even something as extreme as cancer can be related to hyperstress, heart disease, Epstein-Barr, ALS, MS, different things like this are due to a prolonged stress state. And it's a subconscious state. So it's not about how you feel, it's about how you actually function. And a lot of people say, well, I feel good. I go, okay, well, we live in Colorado, and how much pot have you been smoking? Because I get a lot of people that actually move here just for the marijuana.
Do they think that'll reduce their stress?
Well, they think they'll feel better. Their pain will go away.
Yeah, it's a number versus a cure.
Exactly, but how are we gonna actually change the stressor? How are we gonna reset the brain to heal itself? Now, if you look at an allopathic model, it's turn off the nerve, turn off the receptor site, turn off the receiver, and that's what drugs do. Or if it doesn't do it long enough, cut it out, because then it can't cause problems. But I have a woman who's come in here, and she's had ovarian cancer 6 times. But they took her ovaries.
Yeah.
So why is the body still making the cancer in the same place? Over and over and over and over again. It's because she's chronically stressed and her body has one area that it can't communicate correctly to, and that's where the cancer keeps growing. So it's a bigger thing than just structure. It's seeing how does the structure relate to the neurology, and how does the neurology relate to the structure, and how does the neurology affect the hormones? Because the neurology runs everything. You can look in any medical textbook and it'll state that, and then they skip over and say, now let's do chemical therapy, which are drugs, instead of looking at the neurology itself. Did that answer your question? Cool. You guys have any other? Excellent. Well, that was awesome.
Wonderful.
I gotta go home early today.